Healthcare is a primary issue that our new president, Donald Trump, needs to prioritize.
With a new Republican president coming in, this issue becomes even more urgent because it will decide the future of healthcare.
Programs like Obamacare sound appealing at first,
But when you take a closer look, there's important issues that we need to address. One person who has a lower income may put in a small portion of their paycheck into the national pot.
whereas someone with a high income contributes more into the national pot.
Anyone, no matter what your paycheck brings, can take out as much money as they need to pay for their medical finances.
This French system is what Obama tried to mimic through his creation of Obamacare, but it's still evident that there are some downfalls. When President Obama signed this bill, he promised multiple benefits.
He promised to make health insurance more accessible to every citizen,
Nobody can be denied health insurance.
and it stops companies from raising rates or dropping you when you get sick. In reality, when Obama enacted this bill, there were many positives, however, there are also many catches.
For almost every positive, there's a counteracting negative.
It helped over 500,000 uninsured patients with out-of-pocket cost.
However, all Americans who met the minimum yearly wage had to pay Obamacare taxes, which means poorer households who just barely met the wage were strongly affected.
Another benefit was that the Children's Health Insurance Program insured over 9 million children across the country.
However, federal and state taxes had to be collected to use this as funding.
And when you force millions of people to buy expensive and unaffordable insurance, it's not that surprising to see premiums going up. Deductibles are going up too.
After companies reach a certain number of employees, the owner must start providing health insurance.
To avoid this, some companies will fire employees to stay in the minimum amount of workers.
The minimum amount of workers for a company is 50, so for example, a company might let go of 5 employees to avoid lending out health care.
Not only does this gravely affect families, it also hurts the company because they have fewer employees to make work more efficient.
Doing nothing. They reform health care without devastating taxpayers.
Due to CVS company policies,
We cannot disclose our interviewer's name or face.
Cost has definitely increased for the patient. Time in order to get the prescription has increased.
Obamacare affects what medicine patients can take and when they can take it.
This can make patients go for days without their medication, which can be a deadly risk.
Or patients end up trying a medication they've already tried in order to check it off their list so insurance will pay for it.
It affects every single person every single day.
More than half of Americans have taken a prescription drug in the past month.
Obamacare is forcing many of these patients to switch providers, which diminishes the pharmacist and patient bond.
This can cause a bunch of issues.
The new pharmacist no longer knows what they react to and what works best for them.
This can lead to countless errors and mistakes.
Again, nobody has been better on talking about the doctor-patient relationship and what you do to be sure that doesn't become the bureaucrat-patient relationship.
Over 4.7 million Americans had their health care plans canceled.
This year, Missourians who purchase health insurance on the Obamacare exchanges will see an average of a 25% increase on their premium.
In addition to increased costs, families in Missouri and across the nation have lost the ability to choose a plan that best suits their healthcare needs.
Missourians in 97 out of 114 counties in the cities of St. Louis will only have one option on the exchange.
The House will vote on a bill that would eliminate key parts of Obamacare and stop taxpayer funding for abortion providers, such as Planned Parenthood.
As you can see in this graph, comparing healthcare costs by age to other countries, there's a large spike in the United States after the age of 60.
However, there are ways this issue can be solved and should be because Medicare for older patients is climbing at rates of a normal person's yearly salary.
Providing more flexibility and more authority for providers, especially physicians, to make decisions and to use resources that they think are appropriate in the treatment of a patient in a way that's less tied to just what Medicare happens to pay for or not. And what
Transparency of cost, really, and why the increases are necessary, and does it really cost that much to research it, manufacture it, and produce it.
Now that we know the issues facing our healthcare system, it's up to our new president to decide what to do.
As our new country is moving forward with technology, we can use this to benefit healthcare.
We can use things such as e-visits, healthcare apps, and diagnostic tools, and no hidden fees within the prices of medications.
About the EpiPens, for instance.
Oh, we heard about
Huge
that, yeah.
price hikes, and you would think with inflation hasn't gone up that much to where something's going to go from $100 to over
becomes
$500.
law, patients will be able to choose a health insurance plan that works for them without Washington getting in the way. That's the problem with Obamacare. It forces people to buy insurance that's much more expensive than what they need.
Real health reform should lower, not raise costs,
Expand, not ration care.
and protect today's seniors, not cut their Medicare.
We need to keep what is working and fix what is broken in healthcare. Having a new president always faces serious responsibilities and changes for everyone.
Healthcare is something that needs to be touched on heavily because it can improve everybody's quality of life.
As our world is growing rapidly, we want our healthcare to grow and improve with us.
You never know what could happen, but having a reliable backup plan such as healthcare is a comfort everyone should have.